Hi guys, you are welcome to our today video. Today we want to continue on our update on the new added skills in the EE, which is the express entry. And for those of us that has been following, for those of us that have our background on the express entry, you understand, because I wouldn't want to go back because this one will be a bit lengthy and we'll break it down into 2 or 3 different sections. So the first category are for the French speakers. The French speakers. So if you speak French, these are the requirements. To be eligible, you must have a French language test result that shows a minimum score of 7 in all 4 languages. That means reading, writing, speaking, and listening. So this is how they test for language proficiencies. So you must score 7. You must score 7 in all 4 languages. In all 4 languages, it has to do with speaking, reading, listening, and writing. Abilities of the nivos. You know, nivos is the body that Canada accepts. Nivos the competence linguistic candidates. So that is just it. You must kind of score 7 in all. So what it means is this: you must score band 7 and you must score band 7. You must score 7 in all the language. In the reading, you must score 7. In writing, you must score 7. In speaking, you must score 7. In listening, you must score 7. So if you score 6, you may have overall band of 7. But if you don't score 7 in each of these requirements, in each of this language as it is specified, you will not be considered eligible. So when going for your test, and it's a must, your proficiency from your school is not accepted. You must kind of present this as your requirement. That is number 1 for French speakers. This is only your requirement. So if you are a French speaker and this is your requirement, why don't you kind of buckle yourself, tighten your button, and kind of push it? So this is for French speakers. And I want to quickly go for healthcare occupation. This is a bit lengthy. The healthcare occupation, you must have accumulated within the past 3 years at least 6 months of continuous work experience in Canada or abroad. In the past 3 years, you must have accumulated 6 months of continuous work experience, no break. All right. So if you work 1 year, let's assume you work 1 year. In 1 year, you went for 1 month or 2 months vacation or leave, you must have also accumulated and meet this requirement. So, and which there are, I wouldn't want to concentrate on the knock and code because you may not understand it. Let me just kind of read the occupations. Specialists in clinical and laboratory medicine, specialists in surgery, therapists in counseling and related specialized therapies, traditional Chinese medicine practitioners, and acupuncturists. All right, those that specialize in acupuncture, then they are needed here. Other practitioners of natural healing, other professionals occupation in health diagnosing and treating, other technical occupation in therapy and assessment, paramedical occupations. If you are in paramedics, you are needed here. Pharmacy technical assistant and pharmacy assistant. So if you have most of this way, you must have a recommendation from a trained pharmacist to show that you are a pharmacy assistant. So you must have 2 recommendations. That's what I kind of advise, because from the research I've done online, you must have 2 recommendations from a trained and a senior pharmacist. All right, a senior pharmacist to show that you are a pharmacy assistant. Then physician assistant, midwives, and allied health professionals. Physician assistant, midwives, and allied health professionals. And for a physician assistant, you must also get a recommendation from a physician, from a senior doctor. You must get a recommendation to show that you are a physician assistant. The midwives, like in Africa, they have it as nursing/midwives. So here, they have for registered nursing and they specifically have for midwives. So if you have those 2 certificates, you can equally apply. Then physiotherapists, psychologists, registered nurses, and registered psychiatric nurses. Registered nurses and registered psychiatric nurses. The way Canada them down, that's the same way Ireland did their own. You must be a registered nurse and a registered psychiatric nurse, and they will grade you side by side. They will grade you on registered nurse and they will also grade you on registered psychiatric nurse. This one, you can apply if you are a registered nurse, but not in this knock. When applying, you quickly check your own knock. All right. So if you are a registered nurse and a registered psychiatric nurse, you apply under this knock. I will list all the knock numbers in my channel. All the knock numbers, I will list them in my channel. Alright? So, this is for healthcare, and like I said, this video will be a bit lengthy. The respiratory therapist, clinical perfusionist, and cardiopulmonary technologists, those that can specialize in the heart. So, then medical laboratory assistant and related technical occupations. Medical laboratory assistant, that means you have an ND or HND. For medical laboratory assistant, I wouldn't recommend you get a recommendation to show that you should have ND or HND, especially ND, that qualifies you as a medical laboratory assistant. The medical laboratory technologist, you should have an HND. That's medical laboratory technologist, you should have an HND. Then if you are a medical laboratory scientist, you should have BSc or Masters. So this is how they are graded. Alright. Then medical radiation technologist. Medical radiation technology, those that do X-ray, CT scan, and all form of scan. So you are a radiation technologist. Then medical sonographers. Medical sonographers, okay, you know what to do. I've come across medical sonographer before, but I wouldn't know exactly what they do now. So medical sonographer, then nurses aid, orderlies, and patient service associate. Nurses aid, they can be referred as healthcare assistant or a healthcare supervisor. So you are a nurse aid. Then you should have document to show that you are a nurse aid. Then nurse practitioners, nursing coordinators and supervisors, occupational therapists. I think in some countries they have them as health and occupational therapists. Then optometrist, yes. And if you're an optometry, I think I have somebody sent me one slot for optometry. Please, you can DM me. I have that one, optometry. Then other assisting occupation in support of healthcare services, assistant healthcare workers. You are needed here. Then the final one is audiologist in speech language pathologist. So if you are a speech therapist, so those that are speech therapists, you can apply under this NOC 31112. NOC 31112, that is audiologist and speech language pathologist. Then chiropractors, what they call them? Chiropractors, those that specialize in bone. Chiropractors, those that specialize in bone, what they treat bone not by surgery but by massage. So this is your job. Chiropractors, then dentists, dentitians, and nutritionists. Sorry, dentitians and nutritionists, then education counselors, that is psychologists, then general practitioners and family physicians, instructors of persons with disabilities, then kinesiologists and other professional occupation in therapy assessment. I think it has to do with therapy. Then licensed practical nurses. So if you check I head on to this place. This one is different from nurses, assistant, and midwife, and registered nurses. So they are in two different NOCs. So licensed practical nurses, you are licensed to practice. You're not just a registered nurse, but you are licensed to practice. You belong to the different association in your country, and for you to be a licensed practical nurse, you must have evaluated your certificate from your country to that of Canada standard. So if you've done that, you are to apply under the NOC 32101. Then massage therapist. So these are those that are needed in this new skill, this new added 6 skills in the express entry skill based system. So guys, this is part 1. They will soon come up with the other ones.